Welcome back, everybody. Dr. Blumenthal with Natural Transplants in the Bethesda office, and we are thrilled to have Sean today. Sean's coming all the way from Northern Virginia, not a far ride, but with traffic it can take a while. But welcome, Sean. Thanks for doing this with everybody. We appreciate it.
Yeah, thank you.
Sharing your story. Hopefully it'll help somebody. If you wouldn't mind sharing your story with everyone, what brings you to us?
Yeah, over the past couple of years, I just noticed my hair thinning and receding, and then also on top, it just thinning out. So I wanted to do something about it, and so I just looked up some different surgeons in the area and found great ratings here. So I got in contact, got a consultation, and I just really felt good about it, and
Awesome.
I wanted to get some results, and I'm looking forward to this.
Awesome. No, I didn't even ask you before. Have you tried any like Propecia, Rogaine, any of those things sort of leading up to this?
I tried
Yeah.
Rogaine, and I'm not sure how well it worked
Yeah.
because I continued to lose it.
Yeah.
And so I'm hoping that I see better results with this.
Yeah,
and I expect to.
Yeah, and even if it is successful, a lot of guys taking it every day, that's not something us guys like to do. We oftentimes get lazy and end up stopping it at some point. But awesome. Again, thanks for doing this. I'm going to have Zane zoom in a little bit, and I'm going to kind of pull your hair back so we can kind of see the extent. We have a little bit of loss in the front. We're not really going to drop. We've sort of already talked about this. We're not going to drop the hairline at all, but we're just going to kind of reinforce where it is, make it a little bit more full and thick. And then we're going to fill in the corners on both sides. And then I'm going to have you drop your head a little bit for me. And then the thinning here as well, too. So we're going to fill the crown in as well. And he's got good density behind and around it. Awesome. And we did talk, again, like we said, the expected results is about a third of the density in the back of the head. So anywhere from 30 to 40%. Sometimes for some guys, it may require what I call a second coat of paint to match the density better. So we may get that 30 to 40% as expected, but it still may look thinner than the rest of the hair around it, like I did with mine. Some guys may want a second coat of paint. Usually it's my younger Caucasian patients because the hair type, doesn't provide as thick results as my African American patients with curlier, thicker hair. So that may be something in your future. Hopefully not. Hopefully one's enough, and that's awesome. But I always kind of bring that up just so it's not a shock later if you do want to do a second coat of paint to double that density. So now instead of 30 to 40, it's going to be 60 to 80%. But we're going to hopefully it'll be one. It's going to be awesome. We're going to have a great day today.
Looking forward to it.
Awesome, man. Appreciate it. We're going to do a little bit of shaving, a little bit of drawing. We'll get back to you. We'll kind of check in with you shortly, okay?
Great, thank you.
All right, everybody, welcome back. We are with Sean, and as you can tell, we just drew the lines. You doing all right? Excited?
All right.
Okay. Sometimes the shaving can shock people into seeing what their future self looks like. But like I said, we did not drop the hairline at all. We're really just reinforcing it. I shaved a little bit of it back, so that's why it looks lower. But we actually added some temples. I wasn't expecting that at first, but once we drew the hairline, I felt like the temples needed to be done. So we drew it in there. Sometimes it's worth it, sometimes it's not. For him, I think it really is worth it and really impacts it a lot. And he mentioned that he really, he wants to get rid of kind of these corners here. And so I think the temples are going to add a lot. Even just a subtle change in the temples, 10 degrees, 5 degrees can make a huge difference. So I think for him, it's going to look really, really good. And then I'm going to spin you around. And then we got the Three Stooges look back here, shaved. So we're going to be doing the crown as well. And then we shaved the strip in the back. From ear to ear, it goes like that. All the way around. So I'm excited, man. How you feel? Doing all right?
Can't wait.
Awesome. So we're going to head next door, start the magic, and then we'll check in with you a little later. Cool. Awesome.
Sounds good.
All right, Sean, we are back. We are just finishing up the grafts here, just kind of cleaning up a little bit. How's the day going so far, man?
Going really great.
Doing all right?
Feel good.
You doing any pain at all?
Just a little.
A little bit? Just a little
Yeah.
tightness, a little soreness?
Yep.
Yeah.
That's it.
very normal. You had good lunch. We've been watching Schitt's Creek all day, just enjoying ourselves. So this is sort of, like I said, the last couple minutes, we're just cleaning you up, and then I'll meet you in the other room, and we'll go over all the instructions, what to do afterwards, all right?
Sounds great.
Sounds good, man. All right.
Thanks.
All right, we are back with Sean. Sean, you made it, man. You made it alive.
I made it.
Congratulations. Welcome to the family. You did it. Good. Tell everybody how the day went, and be honest.
It went really well. Got to watch TV all day. It went everything was really mild.
Yeah.
The only pain I felt was like a mild headache toward the end. So
yeah. And even sitting in a chair for 6 hours, you can get a little stiff and sore anyway.
Yeah,
so.
yeah.
And you did great with the injections. You were a very easy patient today, so you did fantastic.
Yeah.
Awesome. So obviously there's some swelling. We have Zane just sort of zoom in a little bit. Obviously there's some swelling today. That'll take a couple days. It'll actually get worse before it gets better. And then by a week it should be all gone. But we reinforced this hairline here. Again, brought in some temple work, even just about a 10-degree improvement on the temples. I think it's going to be a huge improvement for him. Filled in the recession areas, and then I'm gonna kind of spin you around here to the back, and you can see the grafts on the top of the crown. That looks really nice. So, and then I don't have gloves on, so I'm not going to show you, but the incisions back here, a little bit oozing, but otherwise you're never going to see that with your hair covering it over. So, awesome, man. So appreciate you doing this for everybody. Any words of encouragement or words of advice to anybody out there kind of on the fence, sort of debating it?
It's really supportive staff and team. I would suggest anyone that's being hesitant to at least get a consultation.
Thank you.
Yeah.
Again, welcome to the family, and hopefully we'll be able to follow you along over the year, and kind of see the after pictures, and kind of hopefully the year goes well.
Yeah, I can't wait.
Awesome, man. Thanks for doing this.
Yeah.
All right.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.